Hey everyone, this is Dr. David, physical therapist from El Paso Manual Physical Therapy, and I wanted to answer the question today, what is a muscle imbalance? And how do I know if I've got one? It's something that I bring up to many clients that come through our practice, and the reason why I bring it up is because it's usually influencing their pain or their condition, an arthritic condition, an irritated nerve. It's usually an underlying reason for their pain. And let me just go into a little bit of detail, technical background stuff. A muscle imbalance in its simplest form is just when one muscle is too weak or strong compared to the other muscle that opposes it. So let me give you a simple example. If you think of a bicep and a tricep, the bicep bends the elbow, whereas the tricep extends the elbow. Now, at rest, when I'm not doing anything, my elbow should relax straight, but I have an imbalance here. If you look at my arm, it's a little bit bent, and I have room to straighten it out, but I have an imbalance. My bicep's too strong, or if you want to look at it the other way, my tricep is too weak. And so this actually causes problems to me. This is an issue that I deal with, and if you look at my elbows, my right side is bent kind of sideways here. I have kind of more tissue out here relative to the other side, and I get some elbow issues, and I have some wrist issues as a result. Long story, but it's being set up from a muscle imbalance. Now, if you were to take an x-ray or an MRI of my elbow and all this area, things would probably look normal. Just like many people that come into the clinic and they come back with a relatively normal looking x-ray or MRI of their spine or their back, their neck, or their shoulder, hips, and knees. Now, a muscle imbalance is something that those tests won't pick up. They're just not, that's not what they're supposed to do. We have to look at the soft tissue and the relative strength and the activity that you're doing, because sometimes those muscle imbalances are adaptive. For instance, if you're a cyclist, you tend to spend time in a hunched over position with your knees tucked in, and you don't straighten out your legs all the way, so your hip flexors are probably going to be shorter relative to your glutes, and it could cause some problems if the imbalance is way too bad. In the spine, muscle imbalances are way more complicated because it's not a simple joint that bends this way. The spine moves in every single direction, forward, back, sideways, twisting, and you can have combinations of movements as well. And when you think of all the activities that you're doing in a typical day, like walking, doing your chores, if you like to exercise, if you go run, lift weights, squatting, CrossFit, yoga, Pilates, all those kinds of activities require that your spine, your hips, knees, shoulders, all the joints in your body are stabilized adequately and then moving appropriately. And if you've got a pretty bad muscle imbalance, that's not going to happen well. The thing about our bodies is they are super resilient. They can take a beating before they even let you know about it. And the example I always use is if you think of diabetes. You don't get diabetes the first time that you have a donut or a hamburger. It takes days, weeks, months, years of eating not too good to eventually get a diabetes type 2 diagnosis, or alcoholism, same thing. Like you don't get liver disease when you have one drink. You have to drink for a long time, pretty consistently, and your liver actually has to shrink down to like a third of its usual size before you actually start getting the really bad liver disease signs and symptoms. So our body can take quite a bit. You can lose a lot of tissue, you can damage a lot of tissue before it actually becomes an issue. So that's why these back issues, the degenerative joint disease, degenerative disc disease, the shoulder problems, rotator cuff tears, the knee problems, all those problems don't usually pop up right away. They pop up after some time. Usually it hits people in their 30s, 40s, or later, 50s and 60s. If you're a very active person, you do a lot of exercise, it's probably going to hit you a little bit sooner. If you're a little less active, it's probably going to hit you later in life if it's going to be an issue for you. So here at El Paso Manual Physical Therapy, we specialize in helping people to get off pain medications, avoid surgery, stay active, keep up your lifestyle. And we love getting the people that come in and have maybe had an MRI or an X-ray and they didn't find anything wrong, but you're still dealing with some problem. Shoulder's still hurting, or the neck or the back is still hurting, the knee is bothering you, and nobody wants to operate on it because there's nothing to really fix surgically. You're tired of taking pain medications, or you just want to avoid it completely, or maybe you're looking to prevent taking pain medications ever, or prevent ever having to even talk to a surgeon about this. This is the place for you. We are experts at finding those muscle imbalances, unique ones even, like in the hand or in the foot, of course in the spine, back and neck, and we can tell you how to fix them. Now, one caution is it can take a while to fix a muscle imbalance. Just like it might take months, maybe even years to gain overall body strength, like to get stronger in squatting or bench pressing or something like that, it can take a long time to reverse that muscle imbalance. But as soon as you start reversing it, you should note that it is getting better. So I hope this was helpful for everyone. Please let me know if you have any questions, and we'd be glad to answer them. Thanks.